So before going to the parotid gland, the borders, the surfaces, first we have to know what it is covered of. So the parotid gland or majority of the glands will have capsules or coverings. So any gland will have a true capsule and a false capsule. So parotid gland is also having certain coverings which are known as capsule. So this capsule, true and false. The true capsule is nothing but which is made up of the stroma of the gland itself. Okay. So the immediate covering, the true capsule of the gland. So if this is the gland, there is a covering like this, the immediate covering, which is formed of nothing but the stroma or the connective tissue which covers which is from the gland. The stroma, the fibrous stroma of the gland itself will form a connective tissue covering which is known as true capsule. So that is therefore majority of the glands. Coming to the false capsule. So false capsule means some other structure is coming and covering it. Okay. So in case of parotid gland, the false capsule is formed by the deep cervical fascia. So as already you have studied in your head and neck part, okay, there is the deep cervical fascia which is divided into various layers. It has got a investing layer of deep cervical, prevertebral, pretracheal, buccopharyngeal, pharyngobasilar, carotid sheath. So all these are parts of deep cervical fascia. But we are concerned with one part of the deep cervical fascia which is covering the parotid gland, which forms the false capsule, which is nothing but the investing layer of deep cervical fascia. So what is happening? This is the parotid gland. So the investing layer, okay, of the deep cervical means related to neck, okay. So the investing layer of deep cervical fascia will come and will cover the parotid gland and forms the false capsule. So the coverings of parotid gland, two, one is true capsule, other one is false capsule. So true capsule nothing but condensation of fibrous stroma of the gland. False capsule coming from the investing layer of deep cervical fascia, okay, and it will enclose the gland. There is a peculiarity for the enclosing, okay. So the deep cervical fascia, the investing layer is coming, it is covering the gland. While covering, suppose this is the deep cervical fascia's investing layer coming and covering the gland, it gets splits into two, one superficial and one deep, okay. So the investing layer of deep cervical fascia or the false capsule while covering the parotid gland splits into two, one goes superficially, the other goes deep. So the superficial part will cover the majority of the gland and it will go and attach the zygomatic arch. Okay, this is the gland, this is the false capsule coming, splits into two, one is going superficially, the other one going deep. Superficial part covers the superficial aspect going and getting attached to the zygomatic arch. Okay, the deep part will go to the deeper surface of the parotid gland, and this deep part will modify to form a ligament which is known as stylomandibular ligament. Stylomandibular ligament, which actually separates the parotid gland from another important gland which is situated here, which is nothing but submandibular gland. So coverings, true and false capsule. False capsule splits to two, superficial lamina, deep lamina. Deep lamina's modification stylomandibular ligament, which will actually it will divide the parotid gland, or it will separate the parotid gland from the submandibular gland. So that is about the coverings of the parotid gland. Okay.